Welcome to the second half of the Orthodontics interview series special for general practitioners and pedodontists. I'm your host, Paul Spaziali, and today I have as my guest Dr. Al Macdonald. Dr. Macdonald has been practicing for over 40 years in both Caledonia and Simcoe, Ontario, and over 30 of those years with orthodontics in his practice. He is the co-founder of the Comprehensive Straight Wire Orthodontics course 34 years ago, and also the co-founder of the IAC Practice Management course. Welcome, Dr. Macdonald.
Thanks, Paul. Great to be here.
Great. Now, over the course of the last 34 years of teaching GPs and pedodontists how to put ortho into their practice, you must have had a few questions that you get asked over and over again. Would you mind going over those and sharing with us?
No, I don't mind at all. Normally, when dentists register for our course, we allow them to ask for references, and we will give personal references, or they can just call and ask each one of us, either Dr. Bond or myself, questions about the course. Most of the time when they call, they'll say, well, simply, will I be able to treat most cases when I take your course? That would be their first question. Secondly, they'll say, because of Invisalign today, will I be able to place braces and also do cases with Invisalign? And the yes, we do teach that. And usually in one way or another they ask, can I increase my income by providing orthodontic services in my practice? So those are normally the three questions they ask, Paul.
Okay, great. I'm sure that helps them a lot since it's the top of their minds when they're selecting a course. But now that what would they ask you, but what should they be asking? What are some of the things they might not know but need to know before they decide a course to pick?
Well, that's a good question because they don't always have the information before the course and how to choose a course, or really an understanding of what a quality course is. So the first thing that I would ask if I were taking a course is, are you going to mentor my cases? Because I'm starting with no information. I am going to be getting academic information as well as doing cases, but are you going to mentor me? The second thing I would ask is, are you going to help me to develop my skill range so that I stay within my skill range on my initial cases, and then as I become more and more affluent in orthodontics, will I be able to do more complex cases? That would be the second question I ask. And also, I would want to know at the end of the course, and it is a 2-year program, what's my competency level going to be, and will I feel secure in my ability to supply and to give good quality orthodontics to my patients? So what's my competency going to be at the end of the 2-year program?
Okay, now in order to provide a course that satisfies all those questions that you just talked about, the top 3 that they're asking and the top 3 that they should know, what kind of criteria need to be in a course in order to meet all those questions, in order to answer those questions and give the doctors what they really want in a orthodontics course?
Well, yes, there are a lot of courses there today, especially. There are a few top criteria and top courses, and Rob alluded to it in his interview. That is, of course, that it has to be a complete, comprehensive course. It has to have everything they need to be excellent orthodontic doctors. In our opinion, we've always managed to survive in our course without getting remuneration from third parties, so therefore we're not obligated to talk about anybody's product or prejudice anything we might have to say through influences from corporate structures. I think it's a course that has no connection to any corporate structure. You go to some courses and there's all these vendors at the back of a course. In our course, there'll be no vendors. It's just us. And we will talk about the top products that are there, that are evidence-based. We'll give double-blind random clinical studies to prove this, and so that you get the very best unbiased program that's possible And we also, I think, courses usually have good references from previous past doctors who have taken the course. We usually get that from those doctors who completed the 10 sessions, and also our course does have a lot of CE credits, and we are approved by the American Dental Association as a certified course, so it's recognized by all entities. To make it easier for dentists to choose, we put up a handy comparison chart that dramatically simplifies all the features and benefits of the different types of courses. So the doctor can just go ahead and go over to our website, www.cswfop.com, for the comparison to see the chart.
So you said www.cswfop.com/comparison?
Yeah.
Okay, so you have co-founded the Comprehensive Straight Wire course 34 years ago. Now I'm curious, and a lot of people are curious as well, and like it's very successful. It's been around for 34 years, 909 students that you've graduated from. How did you do it? Where did it start? And what was the motivation there?
Well, first of all, Dr. Bond and I are classmates, and we both decided to go to rural areas to practice dentistry. And in those rural areas, we had a demand for orthodontics from our patients. And the specialties were far away, so simply we started to learn more and more about orthodontics out of a need and a demand from our patients. Also, I think both of us have an incessant enjoyment of knowledge. So because we get along that way so well, and we're always searching for knowledge and searching for new methodologies, and we find that quite interesting. I think people who are professionals are like that. We just kept adding and evolving the course. We basically flew all over the world to get information, even from Dr. Frankel in East Germany, and with the development of growth and so on. And we always continue to update. I just came back from a 4-day seminar myself, and I think we'll just continue to do this as long as we're running the program, because we feel that's ethical and that's an evidence-based approach we want to take.
Fantastic. It's much more than just a course to you. This is a lifelong passion, then, I sense.
It is. I think anything that's important to you does have a passion, and whether it's if you have a passion for dentistry, if you have a passion for orthodontics, if it's your hobby as well as your profession, you can't help but just love it and enjoy it and just thrive on it.
Mm-hmm. All right. During the course, Dr. Macdonald, I understand that you and Dr. Bond split up the sessions that you teach. So if you wouldn't mind going through the sessions that you teach, and not just talking about those sessions, but really, because doctors are going to be listening to this, really what are they going to get out of each session, if you wouldn't mind?
Okay. Well, it's a 2-year, 10-session program, and I do sessions 1, 2, 3, 9, and 10, and Dr. Bond does the central sessions. So I do the beginning sessions and the closing sessions. So I'll go through them one by one and give just a cursory outline. Session 1 basically is to learn the importance of records for diagnosis, learn the importance of bracket placement and attachment placement with Invisalign using typodonts and sterile teeth, learning exactly what straight wire means, learning how to use comprehensive straight wire methodology in our charting system to lead to proper diagnosis and treatment. That's a hands-on course. There's a lot of learning and skill training in that course. It's a fun course because all practitioners love to use their hands, and we're using our hands a lot lot in placing things, but also learning about the intricacies of this pre-torqued, pre-angulated bracket and how that philosophy is transferred over to the Invisalign system. Session 2 has to do with what we call cephalometric knowledge. Now, when you're involved in orthodontics, it's not just moving teeth inside the bone in a mouth. It's also studying the skull diameter and dynamics of the face, both in all three dimensions, both laterally and from a posterior view. We call that anterior posteriorly. Also looking at the jaw and an introduction to joint. And there's a lot of learning here. Session 2 is a tough session. We do provide the doctors with our sessional manuals 1 month in advance or 2 months in advance before each session, so they have time to study. And Session 2 certainly is, if you've never done cephalometrics and you don't know the parts of the skull, and it's a tough course, but it's essential that you learn this so you can provide the standard of care of orthodontics that is the criteria in our profession. Session 3, we start to get into treatment techniques and mechanics, and that's the movement of objects through bone. There's a lot of physics involved. There's a lot of force vectors involved, inertia, moments of force. And that's another tough concept for some people to learn, although in the undergraduate, many dentists who have taken physics and will review the physics of the movement of teeth, coupling of moments and anti-moments and things like that as we go through the 2 years. This is the core of how bodies move through space or move through a resistant media, and it's important that we spend a lot of time on that. And I might say, Paul, I don't know of any other course that teaches the physics and the mechanics of the movement of objects through space or through a resistant medium. Not any course that I know of that's available today that goes into that depth. Session 9, in the second year of the program, has to do with surgical intervention, because there are cases that in adults that are so severe that just moving teeth is not going to repair or fix or improve a person's bite, or for that matter their aesthetics. So we'll be discussing what it would take to do orthodontic surgery in order to correct a case, and how you would work with an orthodontic surgeon in combination with him doing braces or Invisalign and surgery in order to correct a patient's dysfunction. Also, we also teach a whole course in Session 9 about sleep apnea, both non-surgical and the surgical approach, and all the differential diagnosis that has to do with sleep apnea, and referring patients to sleep clinics and working with sleep doctors. Session 10 is a summary session, actually, and we also have our graduation dinner and our certificate presentation in Session 10. There also you learn about some special brackets, and usually that's the latest technology brackets. You know, Paul, every year, every 2 years, new things come out, and we make sure that we include those in Session 10, anything new in orthodontics, so the doctors are completely contemporary when they leave our course and know all the latest techniques and applications. So that's pretty well what I teach in those sessions. It's just a small section or a look into it or a glance at it, but it's a summary of what I teach in those sessions.
Wow, that's quite a bit. And so I guess you and Rob have spent countless hours structuring this course and making it simplified enough for doctors to understand, but yet maintain its comprehensiveness and give them the most thorough possible course so that they can do start and finish any treatment, right?
Right.
Okay, well, between you and Dr. Bond, it seems like you've covered everything. Very good. And for our listeners that want to register for the course, how could they do that?
Well, all they have to do is go to www.cswfop.com. That is www.cswfop.com, and then just click on the Register Now button, and it's just self-explanatory after that. They can register.
And just to clarify for the listeners, that's www.c as in Charlie, S as in Samantha, W, F as in Fred, O, P as in Peter.com, and then they're good.
Yep.
Okay, great. Thank you very much, Dr. Macdonald. It was a pleasure speaking with you as always.
Thanks for all the help, Paul, by the way, and I'm certainly looking forward again this year to meeting all the new doctors and helping them learn how to do orthodontics. It's just a thrill for Dr. Bond and I to do it. Believe me, we feel so fulfilled when those dentists graduate from session 10 and they start a new career inside their own practices.
So today we covered the top 3 questions dentists ask about ortho, the top 3 questions they should ask, and how to choose a course that meets the answers to those questions, and also provide a handy chart for them on the website. That's all for this special GP and Pedodontist Ortho interview series. Thanks for listening, and hope you got a lot out of it.